And just like anybody else, COVID-19 actually has not left no one behind in actually disrupting the livelihood of everyone. And we must know that economic stability is one of the social determinants in healthcare. So whether we like it or not, it will have a direct impact to the health of the nation as well. And I'm also the Secretary General of the Malaysian Medical Association. I'm also a practicing GP. And just like everyone else, we are also not left behind. And we saw a drastic drop in patients at the initial part of the MCO, a drop as much as 70 to 80%. And in some places, it was 100%, especially in commercial centers, in towers, buildings, when there was no activities, commercial activities. So there was no patients at all. There was a drop. And then we were slowly recovering when it was lifted. But again, with the CMCO, again, we saw a big drop again of number of patients. And then we have more than 7,000 GP clinics nationwide with another 1,000 specialist clinics as well. And then if you look at the workforce that the clinics are employing, including the doctors, easily we'll have anything between 40 to 45,000 nationwide. And we have more than close to 90% of them are solo practitioners, individual owners. And then more than 80% of these clinics operates 16 hours. That means they open at 8 o'clock in the morning up to night 11 o'clock, 15 hours clinics. And then for 24 hours clinics, less than 6%. And we must know that many 24 hours clinics also close down. I mean, they reduce the operating hours because there are no activities in the night, okay, but commercial activities, so they've closed down. I mean, they reduce their operating hours, but of course, the operating cost remains. Okay, so basically rental is definitely one of the factors, OPEX, operating costs. And if you look at the rental, it can range even up to 20,000 in areas like Bangsa, in high income areas, and towers, and even Putrajaya, the rent where I got a practice, it ranges around 7 to 8,000 ringgit for one shop plot, a small shop plot in Putrajaya. So when the loan moratorium was very helpful, because why? At least on our personal side, the income, at least we could have used the personal savings to sustain our practice. Because when there is a drastic drop in the number of patients, of course, it will have a direct impact to the revenue as well, and also for the sustainability of the practice. That's one thing. And we need to maintain. One good thing the government did was the wage subsidy that really helped us. And during this difficult period of time, some places, of course, the landlords were kind enough to give discounts of 50%, 30%, but not everyone. There are some places they refuse to give. Probably they also have their own commitments, we do not know. So the rental relief fund, we believe the rental relief fund, if it materializes, and we believe any responsible government should look into this. Because why? We must understand that SMEs is the engine of growth of any countries. Is the engine of growth. Whether you're a coffee shop, you're a small factory, you're a GP, you're a community pharmacy, you're selling noodles, we all are SMEs. We all are the small and medium enterprises that actually is the engine of growth, providing employment. So we believe that from the Malaysian Medical Association, we strongly urge the government to support this rental relief fund. And if do not do that, we believe the businesses are going to collapse, and it will have a direct impact to the livelihood of the people, and will have a direct impact to the social determinants and to the health of the nation as well. So we'd like to thank you, YB, for spearheading this. We hope that more member of parliaments will support this across the political link. I mean, they should be bipartisan on this. And thank you again for this initiative.
Thanks. Sebelum saya